Debate on Vote 6, Health, Western Cape Adjustments Appropriation Bill.
I see the Minister.
Inkulumbuso Hentshona Koloni Helen Zil. Usekela somlomo amalunga abelekekileyo alendlu abachola izindaba siyanibulisa ngale njikalanga. Today I present to this House the adjustment budget of the Department of Health for the 2017-2018 financial year. But before I go any further, today is the 1st of December and it marks the commemoration of the World AIDS Day across the globe. In commemorating the day, I'm just coming up now from Delft Community Health Center, activating the HIV, where we're providing a range of services to the community. Our focus this year is men, where we say wise men know their health status. So it's not only about the men in Delft or the men in the health facilities, but all men, inclusive men who are here in the house. We are saying the message that please take responsibility, know your status, condomize, male medical circumcision, we know that it works. For those all men and everyone else who are on treatment, take your treatment. And as more specifically, because we have got 2,000 new HIV infections coming from the young girls, especially the school girls, because of the age, the generation gap, we are saying, hands off our young girls. Now, coming back to the subject at hand, the Department of Health receives the biggest slice of the budget, which amounts to 21.66699 billion, which is a clear demonstration of how serious this province is about healthcare delivery to those who need it most. Deputy Speaker, despite health having the biggest slice of the budget, we are faced with many challenges, which I'm going to list. I'm not going to dwell on them. We know of the service pressure related to the waiting times, the staff shortage, the budget cuts, the drought and water crisis. As we know that if we could reach day zero, the people who will be affected most are the most vulnerable, which is the patients who are in our hospitals. The IT infrastructure backlogs and cybersecurity, the aging infrastructure, the staff safety, the growing cost of medicine, unfunded mandates. We have seen the pressure related to foreign service pathologies in terms of the increase in the homicide related to from the gunshot wounds, the comorbidities of the disease where people now present with more than one disease. So we are in a fragile position faced with a growing population standing at 6.5 million, with 75% of that number dependent on the public health system, with many people presenting with a complexity of the disease. We have prioritized the staff safety, where, for example, we have got to revise our plan, where we have identified, working with the city of Cape Town, we launched this plan to focus to everyone else using the city's transport management center. The details will be later in our budget speech of 2018. But now I want to table the Department of Health's budget for the 27-18. There's been a reduction of 12.7 million from the main appropriation, and this includes the rollovers, 26.8, which is about the respect of the Global Fund due to the late signing of the new grant, which was about 14.6. The 10.3 million in respect of the bursaries due to the Fees Must Fall campaign, where the students now ended up not being able to submit the necessary documentation for the registration. The 1.8 million related to the EPWP transfers related to the procurement process for a training provider. Other adjustments includes the 39.6 million, which is divided into shifting one to vote one, related to the Department of the Premier to fund the ICT requirements of the Department of Health infrastructure projects. Also, the 515,000 shifted to vote 10, Department of Transport and Public Works, to extend the list of tuition facilities at the Boland Further Education and Training. So in closing, I just want to thank the department, specifically the HOD and the top management, and also all others across, not only in the metro, in all of my 5 rural districts. I also want to thank the patients themselves, especially for some of them who were together with us supporting and even joining the protesting or the walks, raising awareness around the staff safety. The Ministry Department for working 24 hours, as they already know that there's more than 24 hours in a day. Our health professionals, I've got more than 10 categories of health professionals, from nurses, doctors, and all of those. I just want to thank them. I know that it's tough, but for the mere fact that they put more than their 150% into what they do. The Standing Committee Chair, my MPs from the colleagues in both sides, I just want to thank them. Looking forward to a vigorous debate again for the following year. I here table the budget. Thank you, Deputy Speaker.
Thank you, Minister. Honourable Lorraine Botha.
Thank you, Deputy Speaker. Today, we observe World AIDS Day and thank this department for the initiatives by them. Deputy Speaker, as much as the Department of Health has a decrease of 12.7 million rand in its budget, I'm convinced that the DA-led Western Cape will continue to deliver its person-centered quality care across all our facilities in the province, and I therefore support this vote. This is so because the Western Cape Department of Health has consistently been showing that it is delivering quality health care to all those that's using its services in the province. Deputy Speaker, given our water crisis and the understanding that health is a critical service, I'm pleased with Minister Noma French-Mbombo and her department for reprioritizing 33 million rand to deal with the impact of this drought. I'm also looking forward to other projects such as the Catch and Match and e-Vision that the department has introduced to further improve the delivery of health services during the 2017-18 financial year. Deputy Speaker, as we draw nearer to the festive season, I want to acknowledge our doctors, nurses, and especially our EMS personnel who will be on the front line to assist with the traumas as after effects of the silly season in our communities and accidents on our roads. I thank them for the hard yards that they will cover, and to the SAPs as well, who will in some instances render the safety support to the EMS personnel. I once again appeal to communities to support our EMS personnel in order for them to render the services so much needed at the time in our communities. To the Minister, the HOD, all frontline staff members, to the committee coordinator, and the media office, I'd also like to express my sincere gratitude for all the support rendered during this year. I thank you.
Thank you. The Honourable Gopi.
Thank you, Deputy Speaker. From my side, we honour all those who work to treat and reduce HIV and AIDS. We also salute those millions living positively, knowing their status and take their medication. On this World AIDS Day, the theme is Right to Health, and the slogan is Everybody Counts. Let us all work to make this real in our lives. Break the silence, take those suffering from back rooms and bring them into the open to break the stigma. Let's all help to care. It is their right and everybody's duty. Let me get my teeth into the budget adjustment. Why is almost 13 million rand taken away from this key budget? And why is almost 27 million rand rolled over for the delays in filing of posts for bursaries and training? Deputy Speaker, as the MEC has already alluded, health take the biggest slice of the money from the Western Cape budget cake. It serves the most vulnerable and poor, yet this government takes millions away from the health budget in a time when more people are in need of treatment for serious wounds as a result of the wild drug and gang wars. There are many serious problems in this budget. One such problem is spending too much money on Metro District Health Service. This means only one thing. There was not enough money in the main budget. This is bad budget management. There is also almost 12 million rand ran up because a delay of transfer the Western Cape College of Nursing to CPUT. This process takes too long now. 11 million rand goes to non-profit institutions for male circumcision. Big amount of money are shifted to stationery, advert and promotional items. Why was it not done in the main budget? Some staff posts will now also be funded, like a medical manager at Vredendal Hospital and a secretary for Mitchells Plain District Hospital. These could have been in the main budget. There will also be 5 million rand for the shortage in home-based community care workers. This is good, but shows too little were provided in the first place. The 5 million rand for higher education institution to fund the Grooteski neuroscience project to repair and sustain the heritage value is other project that could have been done in the main budget. Something is not addressed anywhere properly is the mysterious and secret complaints mechanism that is put in place to protect the MEC from criticism. Every day we read in the newspaper the most horrible lived experience of people who got bad treatment and services. We never see the outcome of any investigation or the result of the complaint mechanism's work. It only reports to the MEC and never to this legislature in order to give us fair view of what is going on when things go wrong. I thank you, my
Thank you, Member.
Deputy Speaker.
Minister to respond.
Thank you, the chairperson, for your words and also for supporting the budget. And also I want to thank Member Gopi for supporting the budget, because he has just alluded to that. Yes, thank you very much. Because it's the end of the sitting, I don't want to waste much time, because, for example, the complaints mechanism, the standing committee did ask for it, and then we presented to the standing committee in terms of the complaints, and also the issue of the Metro District. I thought it's obvious that 75% of the population of the Western Cape are in the Metro. Therefore, it makes sense to spend much on the Metro. But lastly, in conclusion, as I have already thanked the people, but I just want to caution the creating awareness, because all the social ills, they end up being absorbed by health. The road safety for people traveling, please travel safely, don't abuse alcohol, because it will end up that I have to dispatch the EMS or also the forensic pathology if there is a need for such. Please take care of that. With the death result from the gunshots, mostly homicide, Please take care. We will encourage you to be eyes and ears so that we can reduce such, because it becomes a pile up to our mortuaries. Also, to support specifically the medical interns who are still waiting to be placed for the next year. As you know, that it's a national competency. They're using their own systems in terms of placing them. I just hope that they will make it a point that they resolve the problem, because there are still people who have in place. The province has absorbed more, and also they've take even more than they are supposed to take. And also, again, we are still in the 16 days of activism. We know no one left behind. Please take care, don't be silent. I just want to echo your words that I mustn't be silent. We need to report all of those. Also, we are approaching the International Day of the Person with a Disability. And they take to note that there are people too, we need to consider such. And lastly, use the hotline that we have, where you could just use a please call without necessarily having an airtime. Encourage and sharing that information, or use the 086 number, because there will be a lot of the emergencies around our emergency care. So in case people are on the street and all of those and there are accidents, use that number. Happy holidays. See you next year. Thank you.
That concludes the debate on this vote. The Secretary will read the